Hello, everyone. My name is Dr. Jason Fangacero, and I am the National Vice Chair of the Pediatric Brain Tumor Consortium. And I'm really excited to give you a little overview and some of the highlights of the PBTC. So let's just dive right in and talk a little bit about what the Pediatric Brain Tumor Consortium is and how it was formed. So it was originally formed in 1999 by the National Cancer Institute. So we are celebrating 25 years in existence, which is kind of exciting. But the main goal and the rationale behind the development of the PBTC was to improve the treatment of primary brain tumors in children. And the way that the PBTC tries to do that is to do things rapidly and effectively in not only understanding the biology of pediatric brain tumors, but also by conducting multi-center trials with innovative designs and statistical designs in order to improve the outcome for children with brain tumors. There are some main pediatric brain tumor consortium cores that help contribute to this. One is the logistical core. That's our operations, our statistical and data management core. That's really fundamental to clinical trial development. Then, of course, in pediatric brain tumors, we do a lot of imaging. So we have a neuroimaging core. And then we need to understand how our drugs work in the patient's bodies and the levels of the drugs in the patient's bodies. And so this is why we have a pharmacokinetics core, which looks at drug metabolism. We have a genomics core, which looks at the biology and molecular makeup of the tumors. And then finally, we have a biorepository and pathology central review core, which houses a lot of the samples that we collect from patients' blood and tumor tissue. So let's just kind of look at the numbers of PBTC. I already mentioned that we're very proud that we've been in existence for 25 years. And in those 25 years, we have enrolled over 2,100 patients onto clinical and therapeutic trials. Currently, we have 9 therapeutic trials that are enrolling patients, and we'll talk a little bit more about some of those in the coming slides. And we have completed 42 studies, and many of the data from those studies are published in the medical literature, so it can be shared with the medical community. And then finally, we have 12 completed non-therapeutic studies. And so what that means is sometimes we don't always do a study where we give a new drug or a new treatment strategy, but sometimes we're trying to learn more about the biology of the tumor or understanding imaging better. And so those types of studies help us understand the tumor and the best ways to treat it in the future. So we have many PBTC centers. I've highlighted them on this geographic graph of the United States. And so you can see we're spread across the United States. The way you become a PBTC center is it is a competitive application process, which is quite rigorous. And that way we can guarantee we have top institutions with top expertise. And we're really excited because in the last several years, we just introduced our first international site, which is Sick Kids in Toronto in Canada. So let's talk a little bit about ongoing studies. In the current portfolio of studies, we have clinical trials for a variety of pediatric brain tumors, both newly diagnosed and those that have recurred. And the major categories of tumors that we currently can treat are low-grade glioma, which is the most common pediatric brain tumor that we see, high-grade glioma, and then diffuse intrinsic pontine glioma, DIPG, or diffuse midline glioma, DMG. Those two are kind of grouped together and are some of the most aggressive brain tumors that we see in children. And then medulloblastoma, which is a common malignant brain tumor in children, and ependymoma. So we have clinical trials that span the whole gamut of the most common histologies that we see in pediatric brain tumors. So one of the really cool things about PBTC, I already told you that there are certain organizations and institutions that are PBTC members, but we don't only rely on those centers for our science and our expertise. So people and scientists and institutions outside of the PBTC can contribute their science to form a PBTC study. And this is really important because we know that there is wonderful science being done throughout the United States and Canada, not only at the PBTC sites, for example. And so by allowing these other sites to share their science with us, share their clinical trial and innovation, it really promotes a lot of collaboration, which has been a wonderful thing for the PBTC. And for example, there are numerous ongoing studies through the PBTC that are led or initiated by experts outside of the PBTC. So I've listed a couple of them here. For example, PBTC 55, a trial that uses molecular targeted therapy, has been originated by the group in Phoenix. And then PBTC 60, which is a vaccine study for high-grade glioma, was developed by the group at Roswell Park in New York. And then finally, PBTC 61, which is also for recurrent high-grade glioma, has been established initially by a physician out of MD Anderson. So again, we have brought all these people and their expertise from many institutions together to utilize the structure and expertise of the PBTC to run a clinical trial. So let's talk a little bit more specifically about the trials that we have ongoing and what's exciting right now, what's coming down the pipeline. So I'm going to start with one called PBTC 48. This is actually a really unique trial because instead of having a medicine as a treatment strategy, it uses something called Optune, which is a method of treatment. You can see the patient on the right of this picture wearing a helmet. And Optune is a device that delivers tumor treating fields to the brain to target brain tumors and stop the cancer cells from dividing and eventually cause them to die. Now, interestingly, this strategy has been used effectively in adults with high-grade glioma brain tumors and is in fact FDA approved for that purpose in adults. So the reason we started this study was because of the exciting data in the adults. We wanted to see, one, was this feasible in children and was it safe? And so the first part of this study, PBTC 48, treated children with recurrent high-grade glioma and recurrent ependymoma. And the goals, as I said, were just to see, was this feasible and was this safe? And we actually accomplished those goals. We showed that in that patient population, not only was this device safe, but it was feasible for children to wear this device for prolonged periods of time during the day. And so now, based on that data, the second part of the study, which we're very excited about because it recently opened, is looking at using this device in patients with newly diagnosed diffuse intrinsic pontine glioma, DIPG, in conjunction with radiotherapy. And so, as I mentioned, DIPG is one of the most aggressive brain tumors that we treat in children. And so this innovative therapy, our hope, will be beneficial for this patient population. Okay, let's talk about another trial, PBTC 61. Again, a very unique and innovative trial. This is a phase 2 trial, so that means we're looking at how effective this treatment strategy is using a combination of radiation with something called G207. So interestingly, G207 is a genetically altered herpes simplex virus, HSV. And what it has been shown in adults and in early studies in children with brain tumors that it can fight tumors by targeting the tumor. And so one of the groups that initiated this study, as I mentioned, out of MD Anderson, did small patient population studies locally and showed that not only was it safe, but preliminarily it seemed quite effective. This is a really unique trial because it really requires a lot of expertise that the PBTC is fortunate enough to have. So it requires catheters to be placed near where the tumor was resected, and then the G207 is infused in combination with the radiation therapy. So you really require expert neurosurgeons, radiation oncologists, and imaging experts to make this run smoothly. And again, we're fortunate enough in the PBTC to have all of these experts working together at our major centers. And so we are actually able to move this study that seemingly was only able to be done at one center to broaden it to many centers across the United States. And again, this is for patients with high-grade glioma. Okay, one of the last studies I'm going to talk about that's therapeutic is PBTC 62. This was newly approved, and this is also an interesting and unique study. It uses something called LIT therapy, or laser interstitial thermal therapy, to ablate or kind of almost burn a tumor, and it's being used to treat the most common type of brain tumor we see in pediatrics, a pediatric low-grade glioma. It is a minimally invasive procedure, and it uses these small lasers, as you can see in the cartoon on this slide showing you. And then the laser goes up against the brain tumor to kind of ablate the brain tumor and kill it. And again, this has been done at many institutions locally where there is an expertise at the neurosurgical level, but really it has never been done on a large scale prospectively at many centers. And again, the PBTC construct affords us the ability to have many centers across the nation doing this to see if it's an effective strategy in treating patients both with newly diagnosed and recurrent low-grade glioma. Again, the most common brain tumor that we see in children. And then finally, I wanted to end with a non-therapeutic trial. I mentioned this briefly in the beginning that sometimes we do studies that don't actually treat the tumor, but help us learn information about the tumor so we can develop new strategies of treatment in the future. And so this study, PBTC N14, is a really unique study where we look at the spinal fluid, that liquid that bathes the brain and the spine, and we collect it from patients who have brain tumors to see if we can see what's called cell-free tumor DNA. So what that is pieces of the tumor that are floating in the liquid of the spinal fluid. And why that is important is sometimes we can use that fluid to identify the type of molecular or biologic abnormality in the tumor. It can tell us the level of the tumor and perhaps indicate whether the tumor might be recurring. We don't know that for sure, but that's something we're trying to investigate. And it may also tell us if the tumor remains dormant or in a state of remission. And so the main goal of this study is to collect this fluid in patients with brain tumors and get a better understanding if the collection of this fluid is another marker of early tumor recurrence or tumor response, in addition to what we always use, which is a brain and spine MRI. And again, with that data, we may be able to develop new therapies for future patients. So I want to take a brief moment and talk about the Pediatric Brain Tumor Consortium Foundation, the PBTCF. So as the PBTC I mentioned is funded by the government, we do get some funds to run our trials that way. But unfortunately, that is not sufficient amount of funds to run all of our studies. So the PBTCF has been paramount and essential in running many of our studies by providing additional monies that help open studies at our local sites. So for example, two very large and complicated studies, which I won't go into great detail right now about, but PBTC 58 and PBTC 59 really required multiple experts across many institutions and required a lot of monies to open them at the local sites. The PBTCF provided that money for each of the sites who opened the protocol so that they could overcome those barriers that were financial and open the trial at their sites. Another thing that the PBTCF is essential in is helping us run and support our biannual meeting of the PBTC. Those meetings are essential. We have them twice a year. And not only do we update each other on side effects of therapy, how trials are going in terms of response rates and drug availability, but they also tell us and give us the opportunity to talk about new innovative therapies in person, in a group, so we can develop new strategies for new treatments for patients with pediatric brain tumors. And finally, the last thing I wanted to mention is the PBTCF in 2025 is going to be funding a special think tank symposium to do strategic planning for the Pediatric Brain Tumor Consortium in order to develop new innovative ideas as we move into our next 25 years in fighting patients with pediatric brain tumors. So that's really a whirlwind tour of the Pediatric Brain Tumor Consortium. I hope I got a flavor of what we do and how we work. If you want more information, please feel free to go to our website, pbtc.org. There you can see a list of the trials that are available. You can see the sites that are present and part of the PBTC nationally, and you can reach out to those sites if you have questions. Or if you're interested in donating or want more information about the PBTCF and their mission, you can reach out to them or go to their website at thepbtcf.org. And I will leave you with our 25-year celebration picture. This was our meeting last fall in Houston, Texas. Again, we're very proud to have been running for 25 years successfully, and we really look forward to, as I mentioned, 25 years more or longer in fighting pediatric brain tumors and being innovative in the future. Thank you so much.